It's good to hear that music on this Wednesday afternoon. That always means that it's time for Helping Seniors of Brevard. And let's get right to the show as we introduce the host of the show and the executive director of Helping Seniors of Brevard. Here's Kerry Fink. Hi, Kerry.
Hey, John Harper, thank you. And I guess happy holidays, Merry Christmas. Here we are. We're on the radio. We're exactly 2 weeks before Christmas Eve, and everything, it's beginning to look a lot like Christmas. We're having a lot of festivities going on. And in fact, let me go ahead and introduce our guest today, because we're going to give you a couple of items for your calendar that you're definitely going to want to put these things down, because we have a lot of events coming up in December, and you are invited to each and every one of them. So always great to be on the radio here on 90.3 WEJF FM radio. And welcome if you're listening online, and welcome Dr. Lee Sheldon, who is our guest today.
Kerry, it's great to be with you as always. And yes, we are approaching our holiday season, and Christmas and Hanukkah are right around the corner, and we're all going to have a good time. But meantime, we've got some serious stuff. Oh, we're not going to make it serious, but we're going to talk about some dental considerations that you may not have thought about before. So, and Kerry will ask me all the questions, and maybe I'll come up with some decent answers. You never can tell.
I like it. Well, you know what I really liked about when you sent over some notes and said, hey, here's what we should talk about today. You titled it, Why a Complete Dental Plan Matters. And so here's the point. Like, as you know, our founder and who organized Helping Seniors all those years ago, Joe Steckler, he always talks about planning, how important planning is. He calls it making an aging plan. We call it getting your ducks in a row. But I have a sense that as we get into the heart of today's program, we're going to really learn again why making a plan and a complete plan is going to matter. So just before we get into that, Dr. Sheldon, let's give a couple of, there's so many things going up. We literally, even as this radio show is on the air, we're wrapping up with a series. You know, there's more and more events going on all the time at, we call it Joe's Senior Resource Center. It's that beautiful location that the Omni Healthcare Group has made available to us. They donate space so we can be as efficient. When you make a donation into Helping Seniors, we try to be as 100% efficient as we can with it. And so we're grateful to have this beautiful space, and we call it the Omni Healthcare Building. I think the official name of the building is the Apollo Professional Tower, but it's that 4-story building right there at 1344 South Apollo Boulevard, and we get to take up a big chunk of the second floor. And so literally, as we're on the radio right now, Dr. Sheldon, they are wrapping up a Nourish Your Spirit cooking class. So this is a series that Chef Jillian Zabris with Chefs for Senior is hosting, and it's a great chance to learn how to have some tasty food while learning how to prepare it yourself. And so that's a series that's going to be continuing into 2026. Tomorrow is our senior education series. So we're talking about Thursday, December 11th, and we have two great events for you planned to come out and spend the morning with us. That's 10 to 12 noon right there at Joe's Senior Resource Center, 1344 South Apollo Boulevard. We start at 10 with the Helping Seniors Knowledge College. And speaking of planning, Dr. Sheldon, we spent much of the year in the Knowledge College covering those 7 important steps that we think about when we're talking about making an aging plan. So we're actually going to have a little panel discussion called Your Aging Plan, Putting It All Together. And then I'm really excited because at 11, we're going to welcome in Lydia Rivera, who is a nurse practitioner. She is also the leader of the Central Florida Walk with a Doc program. It's a program we do together with our friends at AARP, and she's actually going to be our speaker on the wellness series from 11 to 12. So it's a free series. You come out, spend the morning with us. They always have some good snacks, door prizes, great chance to just meet some other great folks who attend these. We also have a number of our partners who are there and have displays and information for you. But the most important thing is you're going to learn in Knowledge College. You're going to learn in the wellness series. And then in a little bit, we're going to come back and share with you a couple of holiday events that we want to be sure that you get on your calendar. But I think kind of with that, Dr. Lee Sheldon, let us jump into the conversation about making a complete dental plan. And what does that actually mean for patients and especially for seniors?
Well, let me begin it this way, Kerry. the most expensive dentistry is the dentistry that has to be redone.
Mm-hmm.
There's an awful lot of waste that can occur if you don't have a total plan. And it doesn't mean that you have to spend a lot of money on dentistry. Some people do, some people don't. And certainly based on your budget, that would determine what you can afford and what you can't. But the worst thing that can happen is not just dentistry that has to be redone, but dentistry that you only did part of it, not realizing there was more to do, and therefore you wasted your money doing the first part of it. And that's why, people come in, when they come into our office, whether they just need a cleaning, which is something that I'll determine, or the other doctors will determine, or whether they need a whole mouth rehabilitation. We just need to be able to put that out there so patients aren't spending their money unnecessarily. Not everybody can afford all of the big fees, but what you need to be aware of is what the fees could be so that you can plan. In other words, you don't do part one unless you know that there's part two, part three, part four that you're going to have to do. And if you don't know that there's a part two, part three, part four that you're going to have to do, don't waste your money on part one. Let's come up with a totally different plan that falls within your budget. That's why a complete plan is so important. So, for example, if I see somebody who needs a tooth to be extracted or a root canal to needs to be done, an extraction costs one fee. A root canal plus a crown, which often needs to be done, is a different fee. We don't want you to start on a root canal unless you're prepared to do the crown. Otherwise, you'll have done the root canal, the tooth will still continue to rot after the root canal is done, and then you've wasted your money on the root canal. Let's get the whole plan in place so you can decide whether the extraction should be done and not waste your money on the root canal, or whether do the root canal because you're ready to restore the tooth as well.
As you're talking about that, what I'm hearing is like, first of all, we need to have a plan, but there's also a second part of this, which is called follow through on the plan, right? Because if I hear what you're explaining, first of all, when we don't have a plan, it's very difficult to get where you're trying to go. In other words, you keep just throwing darts at a board, hoping something's going to land. But when you have a plan, you at least have a destination in mind. Oftentimes, Dr. Sheldon, I always talk about it's like, if we all agree that we're going to like Cincinnati, Ohio, at least we know where we're trying to get to. Well, now we can talk about, are we going to drive? Are we going to take a plane? Is there another form of public transportation? But at least we know where we're trying to wind up. But the other thing, I think that what you're really diving into is the fact that suppose we set out for Cincinnati, but then we only do part of the route and we wind up someplace in, I don't know, Tennessee or Kentucky. And to make that whole analogy worse, it's like, well, if we get stuck there, you're saying actually some of the first work that we did could actually be reversed and maybe just put us right back in the place we started from.
That's the biggest problem that can occur. Now, that doesn't mean that we can't plan over a 5 or 10 year period of time. As long as the plan builds upon the next plan builds upon the previous plan. And there are some people who need to implement services over a long period of time. Sometimes that can be done, sometimes that can't. And so we've got to know that in advance so that we know what the correct step one is to take.
Well, it's so interesting. You guys just did a very fantastic, speaking of our wellness series, you guys were just the featured speakers at an event that we held at Joe's Senior Resource Center last month. You and a good colleague of yours, Dr. Chris Naglieri, you guys were presenting a series that everybody, we got so much good feedback. Everybody was so excited. It was very entertaining and educational at the same time. Senior wellness, not so fast on implants. And I was thinking about this is it kind of ties into the conversation we're having today, because if I'm saying this right, he's an endodontist, you're a periodontist, and yet you guys team together to make sure that you can deliver kind of like a whole proper solution and try to not necessarily, even though you guys are at Dr. Sheldon and Furtado Solid Bite, the area's largest implant provider to for people looking for that, and yet you're still kind of focused on saving teeth. But you've explained that you can't just go part way on some of this, like you said, the example, and you were explaining, because you could actually end up going back to square one if you do the root canal, but then you don't do the follow through with the crown. Am I saying that?
Yes,
right?
You are saying correct. And of course, what Dr. Naglieri talked about was the fact that teeth that are infected can be treated and the infections can be reversed. That patients can have infections within their bone due to a dirty tooth, and you clean up the tooth and the infection goes away and the bone comes back. That's not very well known. Same thing occurs in periodontal disease. You can have an infection around the root surface causing bone to be lost, but then you can reverse that. But still, it's incumbent upon you to take the next step to do that, and you need to be prepared to do what the next steps are. So it's why we spend so much time on initial evaluation. It's the reason that I'll dictate notes that say step 1 is this, step 2 is that, step 3 is that, step 4 is that. And we come up, here's what the overall plan is, and go to one of our treatment coordinators and say, this is what he was talking about. If this is good for you, let's do it. If it's not good for you, let's figure that out in advance so that we can come up with a plan that works better. Example, if a patient needs dental implants, that's a high price item. And a patient says, well, I can't afford dental implants. Well, fine, there's also dentures or partial dentures, which are a lower priced item. Let's get that down in advance so that we are not wasting our money trying to save teeth that may not be a good fit for a partial denture. Let's just extract the bad teeth, save the best teeth to hold on to a partial denture, and you'll be saving money in both the short run and the long run, because we'll have been gearing ourselves to a plan that you can't afford. That's why all of this needs to be thought out in advance. You don't want to treat a single tooth in the presence of other disease unless you've got a whole picture of what you're going to do about the other disease, because those, whether you want it or not, the other disease is going to worsen. You're going to have to face that. You might as well know what it is in advance so that you put yourself on the correct road.
Well, we've talked about this before, because I was thinking about on my own personal dental journey. One of the things that I have realized later is that I wish I had known sooner was, and we've talked about this before, like as kids growing up, we were always taught to clean our teeth and to be sure we brush our teeth and floss, because we want to go to the dentist and get a good report because we got no cavities. And nobody really spoke to us in those days about the importance of overall mouth health. We just thought the teeth were these things that were kind of standing on our own. And so we never really think about it. We never really plan about it. And I think one of the points that you're bringing up is that most of us wind up in the dentist's office, especially if we haven't been doing proper cleanings or things like that. We usually wind up when something's hurting. And so that prompts us to call and say, okay, doc, what do we do now?
It's true. Many of our patients that we're seeing have not been to a dentist in 10 or 15 years. It's not unusual for that kind of patient to come to the office. And why don't they come to the office? They're frightened. They're frightened of the dental experience itself. They're frightened of the expense. They're frightened of a lot of different things. And of course, our efforts are to make this a good experience for the patients. The patient is coming in and knows that they have a friend on the other side of the chair that's actually going to help. But when you have abandoned your mouth for that period of time, then a lot of things for some people can occur. And then it's a matter of sorting out, what do we do in order to be able to make things work out best for you. I just had a patient yesterday who had come in and had not seen a dentist in 10 years. She needed no treatment at all other than a cleaning. So It doesn't mean that just because you haven't gone to the dentist, everything is a disaster. It doesn't. If you're taking care of yourself at home, if you're eating right, if you're taking care of your teeth, and you've got, if you've got a good constitution, you may not need us as often as you might think. And then there's the other side of it, with a patient who has just abandoned everything for years and years and years and years and years. And it's either, hey, listen, you could stay this way, you got a couple infections, just extract the teeth, or it's going to be full dentures, or it's going to be implants. And, there's not going to be any compromise here. It's got to be a whole mouth treatment plan. Which way, which way do you want to go? And of course, the patient, needs to consider things, and that's what we do. We consider, we talk. When you're seeing me for the first time, particularly if you haven't seen the dentist for a long time, I know that about 10% of what we talk about is actually going to register with you. It's the reason we have treatment coordinators who have been in dentistry for years and years and years, because, boy, you better have questions, and we better have some people who can answer those questions for you. And, there are times when they say, well, I'd like to speak to Dr. Sheldon again. I want to see what he has to say. Well, yeah, good. That's what we want. We want you to be engaged. We want you to make a decision. We want you to make the best decision for yourself. It's the reason we take a full mouth series of x-rays. It's the reason we do a CT scan on every single patient. I want to be able to discover everything in advance so that at least you're aware of what could occur, what is going to occur, and you can establish the path that's best for you.
Well, that you probably maybe even answered part of the question I was going to ask you about this, but it does come in. So like somebody comes in and says, hey, doc, my mouth is hurting. And then you're kind of like immediately confronted with, well, like, how's the solution? What is it? Do we yank a tooth? Do we try to save a tooth? How do you like sit down? Like, because I guess that's part of making the whole plan.
Yeah, it is. I can tell you that particularly you saw some of that when we talked last month when Dr. Naglieri and I were there. Mm-hmm. If a patient has a full dentition, if the patient has all his or her teeth on one arch or on both arches, my goal is going to be to keep you out of prosthetics. In other words, I want to save every tooth that we can, and very often we can. We talked about, and we've talked about this on the air. We've talked about what is the hopeless tooth, and the hopeless tooth is the hopeless tooth in the eye of the dentist. Not necessarily every dentist is going to agree on what's hopeless and what's not. And what we tried to bring out on in that particular lecture is that a tooth that anybody would have looked at and would have extracted. And this patient said, "There's no way on earth I want this tooth extracted." It was loose. It hurt. It couldn't be used. The patient was banging on it, and the dentist said, "You've got to extract it. Then we're going to send you to a periodontist." And she said, "No, I want to go to the periodontist first." She came into our office, and not only did we save the tooth, but we grew bone back on the tooth without doing any surgery at all. Patients are really, really capable of healing. So when somebody says to you, "You've got periodontal disease, this is hopeless," I don't know about that. I've so many times in my career, I've seen hopeless teeth that others had recommended extracting, and we say, "No. Let's make nice to the tooth. Let's eliminate the source of the infection. And once we eliminate the source of the infection, the body will heal and the bone will come back on a tooth." I see that so often. And these days, now I'm going back on my tender young age. I'm back on the lecture circuit because this has to be known to the profession that, in fact, teeth that that you're saying are hopeless, or teeth that we say, well, a dental implant is better. No, the natural tooth is better. It's almost always better. It's more predictable. It can stay in the mouth. It's less prone to infection once we get the infection under control. We want to be able to make all of those decisions for you and help you make those decisions in advance so that you're spending as little as you have to on dentistry, not as much as you can on dentistry. Dentistry, and particularly dental implants, have been romanticized over the past 10 or 15 years, haven't they? Oh, yes. I went here and I walked in and the teeth were extracted and we put the implants in, and now look at me. I'm smiling. I'm chewing everything. Well, as you know, Kerry, we do that for a living, and we were doing that for a living for a long period of time. You've got to put that into perspective. It isn't only that. That is not always the best treatment. Very often, it's not the best treatment. It's the treatment of last resort. We've got to be able to factor in every aspect of what's going on in your mouth so that you are getting the treatment that you need, and no more treatment than what you need. And certainly we've talked about the problems with dental implants before, and dental implants can become infected. And if you have an infection around a dental implant, it's more difficult to treat than an infection around a natural tooth. All of those things have to be factored in when we're doing that evaluation, that initial evaluation, so that you can understand the pros and cons of everything before you start moving forward with a treatment plan.
Again, it's kind of to the point of the topic today, why a complete dental plan matters is, I guess, a lot of times, maybe especially because we're conditioned with these commercials, get your full smile in an hour. I mean, it's almost like drive-through dentistry for a lack, or at least that's the way the TV commercials often make it seem. And I know you guys have pioneered, like concepts like full mouth in a day kind of things and things like that. But it maybe gives us too much of a reliance on, quote, the instant solution instead of what might be the best solution. And I was thinking about that even as you were explaining about getting people to really be focused on overall mouth health. In fact, we were talking last time we were on the radio together, and I think we shared it when we had the seminar at the Joe Senior Resource Center, that you actually, for years, you've been helping other dental practices get their programs organized. And then also you've been kind of on the forefront of research to make sure that people are getting the best care that they can, to the point that now you have a website which has a lot of great material on it called LeeSheldonLectures.com. And I wanted to bring that up because kind of some of what we're talking about here goes back to kind of what's right there on the opening page. You say the mouth wants to heal.
The mouth does want to heal. The body wants to heal if we do the right things. It's why, Kerry, you talked about Chef Jillian and what she's teaching. It's so easy, and I confront this with my patients every single day. It's so easy to go to the frozen food section or go to the everything pre-cooked section and turn on the microwave and you have a meal that's ready for you in 10 minutes. It's not that much more difficult to take a frying pan, put a little bit of oil in it, and dump whatever you want in it, and put a sauce that may be pre-made and put that on there. And you've got something that's a lot healthier for you. The body is going to respond a lot better to something that is cooked by you than cooked by a machine. So we all of these perspectives are important. We've got a healthy machine if we do the right things to it. If we're looking at, I'm eating sugar all the time, don't. You can say that, but if I'm seeing your mouth deteriorating, I can see that because it's very easy for you to open your mouth, and I look in and I say, "Oh, gee, that's a disaster. I wonder why that's occurring." Well, if I can see that, what do you think is going on with your liver? What do you think is going on with your heart? What do you think is going on with your stomach and with your brain? I can see it because you can open your mouth. I can't open up your brain very easily, but I guarantee if I do, I would see the same kind of a problem there. So we've got to be very, very careful on the preventive mode. There is I know we're going off a little bit topic, but what the heck, there is a doctor. I think I may have told you about this once. Her name is Dr. Ellie. Did I ever talk to you about Dr. Ellie?
Maybe, but let's go for it.
Okay. So Dr. Ellie is a retired pediatric dentist, and she lives in Austin, Texas. And her whole website, go to YouTube, go to Dr. Ellie, Ellie. Go to her on YouTube, and her whole YouTube channel is to how to keep you away from dentists like me. We do major reconstructions. How to avoid seeing somebody like me. In other words, how to prevent you from needing to see the dentist at all. Now, of course, she'll say, of course, you need to see a dentist, but there are a lot of times when you can be, if you're proactive at home, you can reduce the number of reduce the necessity for seeing people like me entirely. We wouldn't have to repair so many things if people didn't abuse themselves so much. And then when they do abuse themselves so much, and then we repair it, and we talked about this in a show once, we can only fix things. You're the one who's going to prevent the disease from recurring after we fixed it. So a site like Dr. Ellie, she gives you some basic tools you can buy for $100, and you've got her whole system, and she can give you the methods that she's found to be successful to prevent you from getting periodontal disease, from getting tooth decay. So there are resources out there that that can help you. There's another one, Dr. Mark Burhen, Burhenne. And if you go to his site and sign up for his newsletter, Mark also looks at what we can do to prevent. And does that correlate with what we do? Absolutely it does. People come in here for repair, as I said, but once they're repaired, I want you following somebody like Dr. Ellie or Dr. Mark to be able to make sure that repair lasts a lifetime. That's the whole idea. So, we've got to be able to really, really work on our own overall health because, as I said, once you're seeing the mouth is going on in the rest of the body as well. Get the rest of it. Get the rest of that working well. The final thought on this part of it. Do we have to go to commercial right now?
Just about, but go ahead.
Okay. Final thought is we just did a case series, not a random case series, 13 continuous patients, and we looked at them periodontally before treatment and after treatment, and compared it to the national data. And patients were doing up to twice as good in our office as the national data is showing. And these are over 25 different studies that were done across the globe. And you can do better. You can, and you don't need to cut to do it. You don't need to extract to do it. Patients can do a lot better all by themselves with a little bit of help from us, and save their teeth.
Sounds good. Dr. Lee Sheldon, noted area periodontist. We're going to continue the conversation on why a complete dental plan matters. Stay with us. We'll be right back.
And that music indicates we're ready to get back into the second half of today's Helping Seniors of Brevard program. And let's reintroduce our very special host, Kerry Fink. Kerry's also the Executive Director of Helping Seniors of Brevard. And Kerry's special guest today, Dr. Lee Sheldon. So, Kerry, go ahead. It's all yours.
All right. Thanks, John Harper. Welcome back to the second half of the Helping Seniors radio gathering. We get together around the radio every Wednesday lunchtime, 12 noon to 1 p.m. right here on 90.3 FM. WEJF. And if you're listening online, WEJF.net, we appreciate you joining us as well. And for those that catch us as a podcast, because we always make these broadcasts available as a podcast, and we find people literally all over can benefit from them because folks look up stuff by topic. And the topic of the day is why a complete dental plan matters. And our guest today is none other than a longtime friend of the Helping Seniors organization, Dr. Lee Sheldon, with Drs. Sheldon and Furtado, Solid Bite. And Dr. Sheldon, first of all, welcome back. And I wanted to, as we were talking about this, people who may not be aware of you need to understand that not only do we jokingly call you the father of dental implants because your practice opening in 1980 or so, you have really brought dental implants to the forefront. But as a periodontist, you've really invested a lot of time and energy in saving teeth. And I guess maybe through that journey, you have really become a proponent and kind of a sought after lecturer on the topics of kind of like why the health of your mouth really impacts the health of you overall. And we were talking just before the break that it kind of works in both directions. You can look in somebody's mouth and start to get a sense of where they are maybe overall. You guys have done a lot of studies. You've been participating in studies where they say heart health has to do with mouth health. And there's all these different things that point us in a direction of thinking that we need to think about our mouth health as it pertains to our overall health.
It's true. The thing that I'm lecturing on right now is that for the first time ever, and I'm only talking about in the past year, we've finally been able to get the tooth root totally clean. We've already strive to do that. We've used a periodontal endoscope so that the hygienists can see better, and made tremendous strides in keeping teeth without doing periodontal surgery, where the hygienist could do everything to get the periodontal disease under control. But there was still a little bit of residual calculus or hard bacteria that was left on the root surface that we can't see. Now, a commonly used chemical called EDTA can be used on the root surface now, and now can get the root surface totally clean. And so what does that mean for the patient? It means for the patient who's been getting periodontal treatment but continually has pockets coming back, now that we've got a method of getting the root surface totally clean with endoscopy plus this very beneficial chemical is placed on the root surface, the opportunity to get more and more reversal of disease becomes more commonplace. So as I go around the lecture circuit now, and of course I'm very proud of what our practice has done, because some of the things we're doing is just different and in my opinion better because of what our hygienists are able to accomplish with our patients. If we can get the root surface totally clean, that means that the body can heal, that the gum tissue and the bone tissue can come back and can stop the disease all by itself, just by virtue of getting the root surface clean. It then says, all right, do we really need to use other chemicals? Do we need to use laser? Do we need to do gum surgery? Do we need to do any of these things now that we finally have gotten the root surface clean? And that all has to do with my research colleagues, Dr. Charles Cobb and Dr. Steve Harrell, who have made this very simple discovery of a commonly known chemical that's been used in dentistry for years and years and years, and now can get the root surface totally clean. So it's a great time to be a periodontal patient. It's a great time to be a periodontist, because all of a sudden we're able to take something that we thought we were doing really well, and now we can do it that much better on a microscopic level, and we get more clean healing than we ever had. So when I go around, and I'm lecturing to a national group on Friday, and I'll be going out to Oregon in April to lecture to the Oregon Dental Association about what we're doing, some of the discoveries that Dr. Cobb and Harold have made, and how we've been able to apply that to our patients. This is new information, and by the way, I'm prepared to be challenged. I know I will be. But it's so good that we've been doing what we have done for 25 years. So we have that base of experience that we can go on and just get the patients even better than we ever have before. It's a marvelous time to be a dental patient. It's a marvelous time to be a dentist, marvelous time to be a periodontist, because we can do so much and do so much less and get so much a better result.
Really, this is the kind of the key part of it. We titled the show, Why a Complete Dental Plan Matters. And it's because you've got to look at the overall situations. I mean, I think a lot of times listeners just say, well, I'm just in here for the cleaning, but they don't really get the, maybe if they're starting with that thinking and they're not at a dentist that kind of thinks the way you guys do on this, they might be getting shortchanged, because really you want to think about the overall implications or kind of the big picture as well.
Yeah, it's true. A friend of mine said, well, I want to start seeing you. Could I make an appointment for an examination and cleaning? I said, nope. No, you can't. I've never done that. And why? I don't know what your periodontal status is. What kind of a cleaning do you need? I don't know what you need. Why is it that we associate a cleaning with an examination? Is that for efficiency? Is that because everybody needs the same kind of cleaning? Well, I don't know that anybody needs the same kind of everything. We're all different. And so that first examination is an assessment. And given the fact that 42% of people in the United States have periodontal disease, well, that's going to be a different type of cleaning than for the other 58% percent of the people that don't. And I don't know before I see you whether you fall into the 42% category or the 58% category. And if you fall in the 42% category, are you in the worst of the 42% or the middle of the 42% or the best of the 42%? So all of this assessment needs to be done. And cleaning is nothing more. If all we're talking about is polishing the teeth to make them whiter, well, that's not doing anything for disease. That may be something that you're doing for cosmetics to remove coffee stains or the like. But if we're talking about getting the root surface clean, the root surface needs to totally be clean in order to be able to stop this periodontal disease and reverse it. And given the fact that so many people have that, we've got to be able to identify that part of it first in order to be able to put you on the correct road for health and not need us nearly as much as you did in the past.
Yeah. What we're talking about today, this topic, why a complete dental plan matters, and we're talking with Dr. Lee Sheldon, noted area periodontist. And this is actually, we're taking this from an article that's going to appear in Senior Scene magazine in the January edition. So when you pick up your January Senior Scene free copy, they put them out at 500 different locations around the county, and look for the center section, which is where Helping Seniors is. We kind of put a yellow border around the pages so that it's very distinctive. And those of us who are old enough, we remember getting good information out of the yellow pages. So we thought that would be fun to call it that. But this article is going to appear there, and you really talk about the prevalence of periodontal disease, saying something like 42% of all adults are impacted. And most of us probably walk around not realizing the significance of that.
Yeah, I think when we're looking at the significance of that, we just had more studies that came out in the past couple of weeks talking about brain function and how that is affected by periodontal disease. It seems that every time we study an organ, we find out the periodontal disease has some kind of effect on it. Now, that's going to have varying effects. Some people are going to be severely affected, some people aren't. But the fact that we're introducing bacteria and viruses and an inflammatory component into the body through the mouth, that's going to, it just doesn't stop in the mouth. You have a bloodstream, you have everything is connected. And so the opportunity for that disease to travel from the mouth to another part of the body has been well established now. And our whole goal is to make sure that doesn't happen, that the disease is confined to the mouth and the disease is then under control or cured. That's what we want. And that's what the goal is. And the earlier that we can see that patient, the better it is, the better our opportunity to come up with that kind of reversal. I'm so proud, Kerry. We've been leaders in technology with dental implants. We have been designing computer-generated surgical guides. We've been doing everything for years and years and years and years and years. And I'm proud of that, but I'm as proud about eliminating the need for some of those fancy things that we do, that in fact we can treat teeth and maybe we can for a third of the price or maybe a quarter of the price get a tooth saved. I think that's pretty neat. I don't go around the country talking about dental implants. I don't go around the country talking about major reconstruction. Number one, I don't do that anymore. The team here does it, but I've been retired from active dentistry for over 10 years. But I get to see, I get to observe, I get to see the fancy dentistry and how good it is and how much the patients like it. But I also get the opportunity of seeing patients for non-surgical treatment and program that and see how well they do too. So yeah, I mean, this practice has been a labor of love. It's provided me with a great deal of satisfaction, and but the whole satisfaction has to do with how well we can get a patient healed and how little we have to do, not how much we can do in order to be able to accomplish that result.
Yeah, there's a couple of things that you were bringing up that I think is very in sync with what we're always trying to teach folks in the helping seniors world. Joe Steckler, who founded us, he always talked about making an aging plan, and like I mentioned before, we try to just call it getting your ducks in a row to make it feel a little bit more, I don't know, accessible or something like that. But at the same time, there's two real rules that kind of go with that. And we always say this. We say, number one, people see a lot of ads on TV, or they might read something, and it's and you're getting a lot of information from a lot of sources. But we say, don't try this on your own. Get a hold of somebody that's local here in our community, that has an excellent reputation and a kind of a skill level that will really help you solve whatever kind of issue you're looking at. And as you know, Dr. Sheldon, we get calls on everything, medical, legal, financial, transportation, you name it, we've probably taken a call on it. And so I'm thinking the same thing. You got to call somebody who's a real expert, like yourself, and your team, Dr. Matt Sheldon, and of course, Dr. Michelle Furtado. And now you guys have actually expanded, right? Because you have actually you brought in another dentist as well. The practice just keeps growing.
You're right. Dr. Vlada Coelho has been with us now for a few months, and she was trained as a specialist in another country. And so she brings, and she's been in the United States for many years. So she brings a new dimension to our restorative care within our practice. So I mean, I'm very fortunate because the doctors here want to have the intention, and actually they're fulfilling what I always wanted, and that was to create an environment where patients were treated like patients, and they're and like people, and they can talk with us, and they can relate with us while they're getting their dental health back in order. And that's what happens here. So the three doctors here, we just met just before this program. We just had a full meeting with our hygienists on the more advanced things that we're doing on periodontal disease and what the new plans are based on some of the research that we talked about. So we're always moving, we're always growing, and everybody is moving in that direction. It's exciting for the doctors, but it's also exciting for the staff members. They can see how we're moving forward and how they're contributing to their own patients' health. So great meeting today. Yeah. We should have recorded that instead of this.
Well, it's all good. But listen, but the point that I wanted to kind of like bring home into this conversation was that you need to find somebody local who helps you. But the second thing that we always say is don't put things off, because usually things related to aging don't get better with time. In fact, there's many precedents for me saying that, particularly when we, like last week, we were talking with board certified elder law attorney Bill Johnson, and we were having a conversation about things people should be thinking about as we approach the new year. And again, if you missed that show, you can always go back and pick it up as a podcast. But the point that I wanted to get at is we're always telling people, like, let's take a big planning view so that we can ride out any bumps that were coming along and be prepared and not be like just shell shocked if something does come our way. And so why I wanted to bring this up is like, because one of the programs that we've talked about that you do is that every patient, obviously, that walks into the practice is different. Some people need a little treatment, some need more. And I love where you start with everybody. You have a great program that's benefited us as a little 501c3 charity immensely. It's called Solid Bite Gives Back, but it gives you as the medical professional an opportunity to really engage with the patient on that first visit and learn what's really going on so that you can make the best recommendation, but also the patient really gets an understanding of where they are. Can you talk about Solid Bite and as we're talking about this whole concept of a complete dental plan?
Yeah, there's no way that I can look at you without getting all of the things that I want to see. And though if I charge them a la carte, then we'd be talking about $600-700 if we did that, and that's prohibitive. You let me have my diagnostic information. You pay $50 to Helping Seniors of Brevard. I get to see what I want. You get the plan that you need. and the charity does well. Now, of course, I don't mind if you give $500 to Helping Seniors of Brevard rather than $50, but it's a check for $50, or you can charge it $50 to Helping Seniors of Brevard. You get the full examination, you get everything we talked about, all of the X-rays, CT scan, and a full plan. So it's worked out very well. I think we're over $300,000 in total collections as we started this program, and we just keep on doing that. And Helping Seniors of Brevard will benefit from this just as you will.
Yeah. So, I mean, it's an important thing because I think it really speaks to the heart of what the radio program is about today, which is that we're talking about why a complete dental plan works or is really the right way to go. Because if you walk in and you just say this tooth hurts or whatever's going on, that's kind of like it could be very well, like they always say, the tip of the iceberg. And what you really want to do is find out what's going on. And I think also a point that we haven't really tapped on yet in going through this is the fact that there's a real benefit, particularly if you're trying to manage everything that you're doing on a fixed income, which was, we know with seniors is often the case, that the very idea of having a plan is going to prevent shocks to your budget, and it's going to help you map out the best course that you can within the resources you have to operate. Am I saying that right?
You are saying that right. And for some people, all they can afford is emergency care. Let's talk about that right now. If all you need and all you can afford is emergency care, well, that's what you get. And sometimes we can't even have that discussion because you walk in with a toothache. Well, I can have that discussion very easily because I can get you numb, and I'm pretty good at that. And then we can have the discussion as to where we're going. And, you're doing it free of pain rather than in pain. And that way you can make appropriate decisions for yourself. The last thing we want to do is say, you got a toothache, get out of here. I'm going to send you over to the root canal specialist and he'll take care of it. No, let's talk about this. Let's make sure it's okay before we start on a road that may be more expensive than what you were anticipating, particularly if you're on a fixed income or you don't have the resources. So let's make these decisions in advance. The least expensive dentistry is extractions. The most expensive dentistry is implants. We can go from one extreme to the other, or we can go somewhere in between. And that's the whole idea of an aging plan that Joe has always talked about and that you're talking about, or a dental plan like we're talking about. Plans are cheap. It is the treatment that's expensive. So let's spend the time planning, which costs literally nothing, or $50 to Helping Seniors of Brevard, so that you make the best plan for yourself.
Yeah, you're still large and in charge of your own destiny with all of it, but at least you have good information rather than kind of, quote, flying blind. It's funny because over the years, I've always had this expression like, well, first you got to know how deep the hole is, and then you can figure out how you're going to fill it up, whatever that problem is that you're facing. And yet the reality is if we won't even confront how deep the hole is, we don't really know. We're just tossing a few shovelfuls of dirt into it. It may not be the thing we need to be doing anyway. And so really everything you're talking about making a comprehensive dental plan is really so important in all this.
I think it's a comprehensive dental plan. I think it's a comprehensive shopping plan. I think it's a comprehensive recipe plan. I think it's a comprehensive health plan. I think it's a comprehensive house plan. All of these things, rather than let it creep up on you, you can establish priorities. You can determine what the when is, but you've got to know what the what is before you determine what the when is. And that's the whole purpose of anybody who's dealing in comprehensive anything, whether it's lawn maintenance or whether it's roofing or whether it's replacing the wall in a house or whatever it is. It's what's it going to entail, and when's the right time to do it, or is this the right thing to do? That's the whole idea about getting an examination done, a dental examination done, and talking about the entire plan so you know where you are and you know what the different alternatives are before you start spending the money.
That makes sense. All right. So we're going to save a moment or two to talk about a couple of holiday events I want to be sure you get on your calendar. Just before we do that, Dr. Sheldon, I wanted to ask one more time to share the number to reach your office if somebody says, I got questions about what you guys were talking about, or maybe they want to follow up and say, okay, I heard you talking about Solid Bite Gives Back. How do they do that?
By all means, call the office, 321-259-8000, or now you can make appointments online at solidbite.com.
Hey, thank you, Dr. Sheldon. So on to holiday fun. So literally this Friday, I already mentioned you might want to join us tomorrow because we have our senior education series 10 to 12 at the Senior Resource Center. But I also want to remind you, Friday morning, 9 to 10, we walk with a doc. In fact, Lydia Rivera is actually going to be talking to us about the whole program tomorrow at the center, but it happens 9 to 10 at Merritt Square Mall, Merritt Island. Come and join the fun. There's always like 35, 45 folks who come out and walk with us, and it is such a fun time. But we're going to do that, and then we're all headed to undo all the good we did by walking in the mall, because we are invited to the residences at Zahn, which is where we're going to have our holiday event. It's a morning drop-in on Friday, December 12th. So you are so welcome to pop in to 1898 South Patrick Drive. They always have a beautiful rooftop party there on the top roof of the residences Zahn, right there at Beachside. You just come over the causeway. If you're on landside, hang a left on South Patrick, and like a mile down the road, you'll see us on the left. It's absolutely free. It's so much fun. You'll meet all your friends from helping seniors there. And if you've ever been around either Zahn Beachside or the residences at Zahn, you know their culinary skills are exceptional. And every year that they've been so kind to host us there for this, they always put on a real great event. And we just get to show up, enjoy it, and look good, and say happy holidays to everybody. So that is this Friday, 10:30 to 12. Also want to point you ahead 1 week from Friday, because we're going to have a small, intimate kind of little gathering, and you're invited right there back at Joe's Senior Resource Center, 1344 South Apollo. This is Friday afternoon. It is the Friday before Christmas, so this would be December 19th, and we're going to be there from 2 to 5 p.m. And our good friend, Chef Jillian Zabris with Chefs for Seniors is going to be there and creating all kinds of like a little fun snacky stuff. But the real purpose of our getting together is to celebrate the holidays and celebrate our founder, Joe Steckler, and his lovely wife, Terry Steckler. We're calling it the Friends of Joe holiday celebration, because it's actually in honor of Joe's birthday, which happens the very next day. And I don't know if you recall, but the city of Melbourne actually calls that Joe Steckler Day in honor of all the great work that he did for so many here in Brevard County. So we hope you'll make a plan to join us at the center. That's going to be on the 19th, 2 to 5. So we'll see you Friday. Well, hopefully we'll see you tomorrow. We'll see you Friday, and hopefully a week from Friday, for lots of good helping seniors and stuff. And for sure, we will see you next Wednesday right back here on 90.3 FM WEJF. Thanks, Dr. Sheldon, and hope everybody has a great week. See you back here next week.